Good afternoon, everybody, and welcome to this, a rebroadcast of a webinar that took place on the 22nd of September. And it is my privilege to introduce to you an esteemed guest who we have online with us, who will be giving us some insight into the subject matter, which is about evidence-based prevention, looking at policy and practice. It has long been stated an accepted principle that the prevention is the most effective way of bringing about change, and I think we all acknowledge that. At the same time, we have just been through a very difficult period with the COVID-19 pandemic, and this has led us to understand that we also recognize that people are having to go through a lot of change, and with change comes a problem, and that is very unsettling. And this is one of the reasons why we are talking about the particular subject today. We have with us today Professor Nazarius Tumwesigye, who I'm going to be introducing to you, and we're looking forward to hearing from him what it is that we can do and how best we can deal with this. But by introduction, Professor Naz is an associate professor in the Department of Epidemiology and Biostatistics and the immediate past chair of the department. He is a country leader in the AU initiated drug epidemiology network, and he is working on a surveillance system for alcohol and drug use in Kampala metropolitan area using data from 10 rehabilitation centers. He has also led research to form an alcohol, drug and addictions center. He has authored and co-authored over 15 papers with connection to alcohol and drug in general, and has supervised several graduate students in the particular field. I welcome you, Professor, and ask you to present your presentation. Thank you very much.
Thanks so much, David. Dear listeners, so my presentation is about alcohol use prevention and the role of environmental prevention initiatives. And I prepared this presentation with my two colleagues. One is called Jimson Tumanyane, another one is called Onesimus Kamachoko. And we are from Makerere University School of Public Health and also part of an alcohol, drugs and addictions research unit, which we prefer to call center. Next. What are we talking about in regard to environmental prevention initiatives? You know, these are the kind of interventions which can be established at state and local government levels and supported by a broad range of community-based organizations. And in particular, we're looking at enforcement, we're looking at I mean, these are just examples. The examples of these kind of interventions are enforcement, there are restrictions on licensing businesses that sell alcohol. There are restrictions on hours of operation of licensed businesses. The increased alcohol beverage prices, you know, that's part of these environmental initiatives. And then policy-related interventions. There are several of these interventions. So I'm just giving you just a few examples of these initiatives. Next. Okay, so let's look at the evidence on some of these prevention initiatives. Increase in purchase prices. There's a lot of evidence that shows that actually when you increase the purchase prices, access to alcohol and the harm due to alcohol is actually minimized. There are several papers, and one of the leading authors is called Stockwell. Reducing affordability, which is also part of pricing. When we make alcohol cheaper, we even give access to even young people, underage young people. So it's really then it's really a problem, and something has to be done. And then taxation. There's a lot of evidence which shows taxation can improve, can reduce harm to alcohol. Taxation can reduce affordability. Taxation can increase the prices, and so on and so forth. So there are several papers, and one of those is found in the WHO report of 2010. Next. Setting minimum prices of alcohol. This is part of an alcohol policy in those countries which have the policy. But studies have shown that actually when this price is increased, then consumption is reduced considerably. And one study found alcohol drinking reduced by 16% in a study by Stockwell. So this is really hard evidence, which any government probably would want to use. Banning products that are likely to attract the vulnerable. We all know very poor people in slum areas. They really, they are vulnerable. Maybe they have taken time without taking alcohol. And when a truck loaded with alcohol, and this alcohol is very, very cheap, you are likely to get these people try it out. And this will be a problem, because these are people who are likely even to get drunk. These are people who are likely to get harm due to alcohol. So what some countries have done, they have banned these sachet alcohol packed in sachets, and this has somehow also helped. I can give you an example of Uganda. It banned sachets, but we are getting reports. The reports actually showing that there is reduced harm, and one particular district is actually called Guru in northern Uganda, where productivity is reported to have increased as a result of restrictions on alcohol, including banning sachets. Okay, next. Okay. Now, the minimum drinking age is also another factor, which is normally put in these alcohol policies. But studies done by several people. We have Tessaleng and others have shown that actually this can work. And Tessaleng has also added that the biggest problem with all these initiatives has been really enforcement, and we are going to see that in a minute. Limiting blood alcohol concentration for drivers has also been found to reduce alcohol-related crashes. It reduces alcohol consumption and also reduces the harm due to alcohol. And this can be found in a Fair and Voa's paper of 2006. Next slide. Okay. Now there's a lot of evidence which has shown that the more awareness you create, the more the people reduce alcohol consumption. There are studies also which have shown that radio talk shows dissemination, and there are so many ways in which awareness can be created. People can talk in churches or in place of worship. You can have advertisements which are really reducing too much alcohol consumption. So there are papers which show that actually this can work. So government can really, they shouldn't really stop. They shouldn't probably reduce budgets for this creating of awareness, thinking that probably it's not working. It works, and there's evidence to show this. There's another way in which governments have also reduced alcohol harm and alcohol consumption. when you have high density of alcohol outlets, you are likely to have more access. And more access means more alcohol consumption, and more alcohol consumption means more harm due to alcohol. And more harm due to alcohol includes violence, it includes all sorts of negative outcomes. And a study has shown that even for each unit increase in outlet density, there is a 0.48 increase in unit increase in mobility per 10,000 persons. So you can imagine. So this is really hard evidence which any government would want to base itself on. Now, there is limiting the days and hours of sale. Even there is evidence for this. A study in Western Australia showed that extending open hours from 24 hours to 1 a.m. increased violent incidents at the late night venues by 70%. So any government which wishes to do something, there's evidence for this. You see, you increase opening hours, that's what you get. You get violent incidents. And that means burden to the hospitals, that means burden to road users, and so on and so forth. Next. Now another evidence which probably could appeal to community leaders anywhere in the world is actually, and it's also partly environmental, and that is community intervention. Some work done by some researchers have termed what happened in Iceland as sort of a miracle. But others look at it as something which can be done by any community, as long as they have very strong resolve to change the status quo. So in Iceland, in 1999, the communities, some parts of the capital city, communities tried to do something about alcohol consumption and drug use. They first did a community study, cross-sectional study, and they analyzed the issues. And they sat down with the stakeholders to really do something. And their action resulted in a serious reduction, a very large reduction in alcohol consumption, in drug use. You can see this chart. In 1999, the levels were almost the same as that of Europe. But then you can see this went down to 90% in Iceland, while in Europe, it was still so high, 56%. So you can imagine, this is really, really a big, I think we all need to learn from what happened in Iceland. If you want to know some of the things they did, you may want to know that that actually their parents, over 74% of their parents in 2016 knew where their children were spending time, and even with whom they were spending time. And this was at the level of 50% in 2000, but you can see it rose to 74%. So there's really serious parental involvement in the lives of young people. Then 80% of these young people were reported having been outside after midnight in 2000, but then this proportion reduced to 31%. So you can see it's really, really like a miracle for anybody who is trying to organize something at community level. So when a child grows up and sees the environment she's living in is that tight, it wants to follow up what she's doing, then she grows. She'll also change her way of living, as can be seen in Iceland. Next slide. So there are challenges in implementation of all this. In developing countries, definitely implementation is very weak. And I can testify for the case of Uganda. And our laws are not only weak, but they're actually outdated. And that's why we are pushing to have an alcohol policy approved by the government. And they are rarely enforced. These laws are rarely enforced. The fines for offenses are too small. In Uganda's case, if they caught you, making illegal alcohol, you can actually be fined 15 cents. Everybody can afford. Everybody trying to brew alcohol can afford this. There's nothing prohibitive here. And we also find that a low proportion of our people, they know alcohol use restrictions, or they take alcohol use restrictions seriously. Next slide. Yeah, so the way forward, we need to really develop alcohol policies. And several countries have done this, but some others have not, especially in Uganda. And then I also wish to add that you don't just develop alcohol policy, but actually make sure that it has been developed independently of forces which can probably make it less effective. Because we all know that some big multinational companies have interfered with alcohol policy development in several countries. So we really don't want that kind of scenario. And then review of existing policies to include all information that are needed for the policy. So those countries which already have a policy, they need to review it. Countries need to put more money in enforcement. It's no good writing a policy and then you don't actually enforce it. Increasing awareness in general population. Yeah, definitely there is more needs to be done for people to understand the dangers of alcohol. To know that they can live a better life even when they don't do alcohol consumption. Then more research needs to be done to provide evidence. And on this note, I wish to tell you that in Makerere University School of Public Health, we've set up an alcohol, drugs, and addictions research unit. And they have said we prefer to call it research center, but it's a number of people interested. It comprises of a number of people who are really interested in researching this, and we're trying to see how we can make a difference. And I'm sure other institutions elsewhere in the world, they may want to really invest more in research, spare some time to research to make a difference to the communities. Next slide. Yeah, so these are references, ladies and gentlemen, for anybody who may want to read or who may want to build on what has been done. Next slide. Okay, so this is the end of my presentation. Thank you so much, ladies and gentlemen, and thanks so much, the organizers. David and Olivia, thanks so much.
Thank you very much, Professor Tumwesigye. It's long been debated on how to address the problem of harmful alcohol consumption, which comes with a burden to society and to governments at large. What you have provided us here is hard evidence, and the initiatives that need to be taken, the resources that have to be put together by government in order to address the problem, as well as how communities, and the lesson learned from Iceland is a very clear example that there is work that can be done. And as you say, more research needs to be done, and solutions will be found. Thank you very much for your presentation, and we appreciate your efforts. Thank you very much.
Thanks so much, David.